Welcome back, everybody. Today, we're going deep into PDE5 inhibitors.
Sounds exciting.
You guys gave us a ton of research articles and medical excerpts, even clinical trial data.
Wow.
It's way more than just the basics on that little blue pill.
Yeah.
We're going way beyond just ED
Okay.
to uncover the science and surprising uses and even controversies around these medications.
Awesome.
Get ready for some aha moments.
Uh-huh.
To help us, we have an expert who can really break down all this complex stuff.
Hey, everyone. Glad to be here.
So,
The story of PDE5 inhibitors is fascinating.
yeah, it really is.
It shows how scientific discoveries can be so unexpected.
Let's start with that. This is one of those classic accidental discovery stories, right?
Absolutely.
Scientists were initially researching these compounds for treating hypertension and angina,
Right.
focusing on blood flow.
Yeah.
And then they stumbled on an interesting side effect.
They did.
The Stat Pearls excerpt mentioned it.
Oh, yeah.
Researchers noticed that, these medications were having certain enhancing effects,
Haha. Precisely.
and that shifted the entire focus of the research.
It really did.
But to understand why these drugs became so important, we got to understand how they work
yeah.
at a molecular level.
Good point.
So break it down for us. What's the mechanism of action?
PDE5 inhibitors block the degradation of a molecule called cyclic guanosine monophosphate.
Cyclic guanosine, what now?
It's also called cGMP.
Okay.
This molecule is crucial for relaxing smooth muscles and increasing blood flow.
So these drugs prevent cGMP from breaking down.
Right.
And that amplifies the effects.
Exactly.
So more cGMP, more relaxation, more blood flow.
Yeah.
And that leads to the outcome for treating ED.
Right.
But this isn't just about a niche issue, right?
Not at all.
ED affects a surprisingly large number of people,
It really does.
but a lot of people.
Huge numbers.
The Stat Pearl source estimated that by 2025, over 320 million people will be experiencing ED.
Wow, that's a lot.
That emphasizes the demand for effective and safe treatments.
Absolutely, safe treatments are critical.
That's a massive number.
It is.
It really puts things in perspective.
Yeah, it does.
And it highlights the fact that PDE5 inhibitors aren't just for one condition.
Right.
They've been approved for other things too,
Right.
like treating pulmonary arterial hypertension or PAH.
Oh, PAH, yeah.
Remind us what PAH is again.
It's a serious condition.
Okay.
It affects the arteries in the lungs.
Oh, wow.
The dosage of PDE5 inhibitors is different for PAH than for ED.
Interesting.
It shows how important precise dosing is.
Yeah.
It depends on the specific condition.
It's not one size fits all.
Nope.
It's so fascinating how these medications discovered in one context can be used for unrelated conditions.
Yeah, you're right.
And it seems like the tip of the iceberg.
Uh-huh. Yeah.
Researchers are looking at PDE5 inhibitors for all kinds of things.
It seems like it.
What areas have caught your eye?
There's a lot of interest in using these meds for conditions ranging from heart disease to oncology,
Wow, oncology.
even cognitive function.
So many possibilities.
There are.
That's amazing.
It is.
From ED to maybe treating cancer.
It's a huge leap.
But before we get ahead of ourselves, we should talk about the risks.
Good point.
Every medication has side effects,
Right.
and PDE5 inhibitors are no exception.
Definitely not.
What are some things people should know about?
Well, you're right. It's super important to consider both the benefits and the risks of any medication.
Yeah.
Some common side effects of PDE5 inhibitors are headaches, flushing, indigestion, and visual disturbances.
Oh, that doesn't sound fun.
Not really.
But those are dose dependent, right?
They are.
More likely at higher doses.
Exactly.
But there are more serious concerns too.
There are.
The Stat Pearls document mentioned a few risks.
Oh, yeah.
That caught my eye.
What were those?
Some serious stuff.
I see. Well, yeah, there are some absolute and relative contraindications.
Oh.
Absolute contraindications are when you should never use the drug.
Got it.
Like the interaction between PDE5 inhibitors and nitrates.
Nitrates, like heart medication.
Yeah, that's dangerous.
How so?
Combining those can cause a huge drop in blood pressure.
And that's bad how?
It could be fatal.
Oh, wow. So nitrates are off limits with PDE5 inhibitors.
Absolutely.
The American College of Cardiology recommends a waiting period between taking them right.
They do.
How long?
At least 1 to 2 days after a PDE5 inhibitor before taking nitrates.
That's important for everyone to know.
For sure.
What about the relative contraindications you mentioned?
Those are situations where you need to be careful
Okay.
and monitor things.
Like what?
Like someone with recent heart problems, low blood pressure, or taking alpha blockers.
They should be careful with PDE5 inhibitors.
Right.
Alpha blockers are often for BPH, right?
They are.
Benign prostatic hyperplasia.
Exactly.
And tadalafil is approved to treat both ED and BPH.
It is.
Wow.
It's interesting.
So many uses.
For sure.
But speaking of risks, there's one more thing from Stat Pearls.
Okay, what's that?
Priapism.
Ah, yes, priapism.
That's where an erection lasts more than 4 hours.
Yeah.
Isn't that like the goal?
Haha, not quite.
No.
Priapism is serious.
Oh, really?
It needs immediate attention.
Wow.
It can damage penile tissue.
I had no idea.
It's important to remember that even medications designed to enhance functions can have unintended consequences.
If not used correctly,
Right.
it shows how important it is to talk to a doctor
Yes, always.
before starting any medication.
Especially PDE5 inhibitors.
Absolutely. Now let's switch gears a bit.
Okay.
One of the research papers goes into oxidative stress and ED.
Interesting.
I found that fascinating.
Yeah, oxidative stress is a complex topic,
But
and
interesting.
it's an imbalance between free radicals and antioxidants in the body.
Free radicals, those are bad, right?
They can be.
So too many free radicals, not enough antioxidants.
Right.
And that's when oxidative stress happens.
Ex-
But how does that relate to ED?
Oxidative stress can disrupt a signaling pathway in the body.
That's needed for erections.
Yeah.
Which pathway is that?
It's the nitric oxide pathway.
Nitric oxide, that's important for blood flow, right?
It is. It relaxes blood vessels.
But oxidative stress messes that up.
yeah, it steals away the nitric oxide.
So instead of relaxing and allowing blood flow,
Things don't work properly.
is that called endothelial dysfunction?
Yes, the lining of the blood vessels gets damaged.
Reducing blood flow to the penis.
Exactly.
Makes sense.
Yeah,
But what causes oxidative stress in the first place?
lots of things.
Like what?
Aging, diabetes, smoking, even stress.
The paper has a diagram showing the NO pathway
Oh, cool.
and how ROS disrupts it.
Visuals are helpful.
Yeah, it's like a roadmap.
Haha. Yeah.
So we've talked about PDE5 inhibitors and oxidative stress.
Right.
Now let's get to what I find most exciting.
What's that?
The potential of these drugs beyond ED and PAH.
Yeah, there's a lot there.
What are some conditions where they might be helpful?
There's a lot of exciting stuff.
What has you most excited?
It's fascinating how these drugs have ripple effects throughout the body.
Give us some highlights. What conditions are we talking about?
Well, for one, there's more and more evidence that PDE5 inhibitors have anti-inflammatory effects.
Anti-inflammatory. That could be big for so many conditions.
Exactly. Think cardiovascular disease, some autoimmune disorders, even cancer.
Whoa, hold on. Okay, tell me more about these anti-inflammatory effects.
Well,
How do they work?
the research is still early,
All right.
but it looks like PDE5 inhibitors can influence the immune response
Really?
in big ways.
How?
One of the papers mentions that sildenafil can impact T-cell regulation and cytokine production.
E-cell what now?
Haha. Yeah, it gets complicated.
Okay.
T-cells are a big part of the immune system,
I see.
and cytokines regulate inflammation.
So PDE5 inhibitors affect those things.
They do.
And that means they can modulate the immune response
And control inflammation.
throughout the body.
Yeah.
Right.
Wow. So they're not just about blood flow.
They're working on the immune system.
Right.
That's incredible.
It is. And this other source lists a bunch of clinical trials
Oh, wow.
for all kinds of conditions.
Like what?
We're talking Alzheimer's, cancer, even fetal growth restriction.
Fetal growth restriction. That's wild.
It is.
But it shows that PDE5 inhibitors can influence all kinds of processes,
Yeah.
not just blood flow.
These drugs are about regulating cellular signaling pathways.
And those pathways are everywhere.
Exactly.
Wow. So we've gone from ED to maybe influencing fetal development?
Seems like it.
The potential is huge.
It's very exciting, but
Yeah.
it's important to remember that the research is still early.
Good point.
We need more data.
Yeah.
We need to be careful of side effects.
Especially with these new applications.
For sure.
So cautious optimism.
Exactly.
Now let's talk about the future.
Okay.
Where do we go from here with PDE5 inhibitors?
Well, the future is promising.
What's on the horizon?
One exciting area is more selective inhibitors.
What does that mean?
They would target specific subtypes of the PDE5 enzyme,
Okay.
and that would minimize side effects.
Why is that so important?
That's-
Remember all those side effects?
Yeah.
Well, a lot of them are because current PDE5 inhibitors aren't very selective.
I see.
They interact with other PDE enzymes.
Causing problems.
Right. By developing more selective drugs.
We could reduce those side effects.
Exactly. Less risk, more benefit.
I like the sound of that.
Me too.
What else is coming?
Another area is dual action compounds.
Dual action.
Yeah, they would combine PDE5 inhibition with another therapy
Oh, wow.
for a synergistic effect.
That sounds powerful. Any examples?
There's research on drugs that combine PDE5 inhibition with nitric oxide donation.
So you're giving the body more nitric oxide directly.
Right, and this combination has shown promise in things like wound healing.
Amazing.
It is.
So we have more selective inhibitors, dual action compounds,
It's like science fiction.
but drug development is tough, right?
Yes.
It is. One of the biggest challenges is the PDE enzyme family itself.
What do you mean?
There are 11 different PDE families, each with multiple subtypes.
That's a lot of enzymes.
It is, and each subtype plays a different role in the body.
So targeting one without causing side effects is hard.
It's like a puzzle.
And that's where personalized medicine comes in.
Exactly.
Tailoring treatments to each person.
Right, because everyone is different.
It's amazing how far we've come from that accidental discovery.
It really is.
It feels like we're just getting started.
Absolutely.
Who knows what else we'll
The
discover?
possibilities are endless.
Well, before we get too carried away,
Yeah.
let's talk about what this all means for the listener.
Okay.
What should they take away from all this?
Well, the big takeaway is that PDE5 inhibitors are more than just for ED.
Right.
They can help with a lot of health conditions.
Knowledge is power.
Absolutely.
Understanding the benefits, risks, and potential is key.
It helps you make good decisions about your health.
Could have said it better myself. Now, we've gone through the science, the applications, the possibilities,
It's been a lot.
but there's one more thing we need to talk about.
Oh, yeah.
It's a topic that causes a lot of debate.
I'm intrigued.
Well, let's get into that in the final part of our deep dive.
Sounds good. Yeah, it's fascinating how these drugs